Hi, I'm Dr. Janet Allenby at Allenby Cosmetic Dermatology. It is always such a pleasure to be able to really impart some of the reasons why we do what we do in the office and help you guys all look the best you can. So what you're seeing today is a treatment called Caravate. It's a hydrofacial for the scalp. It's actually growth factors that are being placed on the surface of the scalp, and it's going to stimulate hair growth, but it also soothes the scalp. So people have eczema or psoriasis, their lesions actually improve. Now, we have seen some great hair growth from this, and that's actually what the treatment is for. And I think if you have a treatment, you're going to be amazed because it doesn't mess up your hair. The product that you use at home is not messy, so you can use this application daily, and you actually see hair grow. When you're dealing with hair loss, you want to make sure you have everything available to get your hair to grow. And that's why I personally take Nutrafol and I do the Caravate treatments. This European peel is a TCA peel, which traditionally was a very strong peel where people's skin would just peel off and they'd be red. This one, you don't peel, you don't turn red, you just look good. And it is a simple peel. You're in the office for 30 minutes. My staff does the peel on you, and you are out doing your normal activity. You really don't have to adjust your life for this peel, which is, again, everybody in my practice, nobody likes to take any downtime. So it's going to take away your pigment spots, it makes your skin glow, the fine wrinkles diminish. It definitely is a beautiful peel. So I hope you guys are enjoying all this cool information. Now, we do have the latest and greatest and the most current treatment for cellulite that's out there today. It is called Versonic, and yes, I've done mine already, so I will tell you, it is definitely a cool treatment. It's a single treatment. You don't have bruising. What it's doing is it's basically using ultrasound to break up the little things that are pulling cellulite down, and it's helping us get that smooth texture we're looking for our butt, for our thighs, the front, the back. This is the newest modality out there, medically speaking, that is going to help us treat our cellulite. This is a procedure done in our East Body Squad office, and there's no downtime to this, so you are looking very normal right when you're done. And usually we have to wait a little bit for the results, but they are definitely seeing great improvement with this. So as you're watching, this is a very simple procedure, and again, there's no bruising, there's no downtime. This is a really simple way of treating your cellulite.
Hi, my name is Christina Monaco. I'm a physician assistant here at Allenby Cosmetic Dermatology, and we are in beautiful Delray Beach, and today we are going to be injecting this lovely 50-something-year-old woman. She came to me complaining about a few areas that were bothering her, and in particular there were three main concerns. The first concern being the mid-cheek area, and of course feeling like she had some folds that were starting to happen around her mouth. This is a very common complaint, if you will, that we have from our patients because they're looking to feel more refreshed, and one of the main areas that we hear all the time in our practice is that they start to notice some fullness or heaviness that's happening around the mouth. Another area that she spoke to me about during our consultation was the area between her jawline and her neck. And this is a very common area as we age. The aging process, to be honest with you, starts as early as our late to mid 20s. And we like to establish a prevention treatment plan with our patients. And when we talk about prevention methods, the reason why we're doing that is because of collagen loss. And when we lose that collagen, we start to notice things start to fall around the middle of our face or around the mouth. In this case, we speak a lot here at Allenby Cosmetic Dermatology about shape. And the reason why we speak about that is to give the overall picture of what we're trying to accomplish. Symmetry, full correction, balance, and a beautiful aesthetic look without being overdone. So in this case, one of the things that I want to accomplish today is, of course, her main concerns, areas around her mouth where she feels that she has some fullness, trying to accomplish some more shape in her jawline so that she doesn't have these folds here. Again, this is very common when we start getting into our 40s and our 50s, and a lot of our patients are trying to come in and say, whether it's a first time treatment or they're a repeat patient, trying to bring everything back so that they have a more balanced look at the end of the day. So today what we're going to accomplish is we're going to use hyaluronic acid fillers to accomplish this result. We are going to be doing 3 main areas. We're going to be doing, like I said, her mid cheek or her cheek. Like a lot of people will come in and they'll talk about the folds around their mouth. And I do not like to just inject around the mouth. When I look at the patient and I assess them for a consultation, I like to see the overall big picture, and I like to explain to the patient that we're trying to reestablish symmetry and shape. And the reason for that is because we're having bone loss and that collagen loss as we age. What we're trying to accomplish with hyaluronic acid fillers is we're trying to accomplish restoring that shape, restoring that youthful look regardless of age. And it doesn't matter. I think it's very important to address that, you know, we want to establish full correction as best as we can while sticking within the patient, what the patient's trying to achieve within their budget, within their time frame, but also making sure that the patient understands the clear expectation at the end of the treatment plan, which is trying to restore that natural shape, that natural balance, but also trying to make the patient happy with why they came in. The other area that we're going to address lastly is the lips. And I think that this is a very common treatment area right now that a lot of patients are coming in for. I like to say the lips are really like the cherry on top, like the last thing that I like to inject. The first 2 areas that I like to inject when a patient comes in is I like to restore that, like I keep saying, symmetry. And the way that we start is we don't like to start around the mouth. I feel like that's a very common, like I said, area where patients are coming in and saying that they feel this fullness. But in order to restore that, we have to actually lift back here in the cheek. The other areas, like I said, that we're accomplishing is the jawline here. So give her more shape so that we have more of a balance between her cheek and her neck, her lower face and her neck, and we're going to do that with hyaluronic acid fillers. That's going to bring all of this up, okay, without having to inject around the mouth. So the patient is going to look more youthful and they're going to have a more balanced, symmetrical look. The last area that we're going to accomplish is her lips. We're going to balance the lower lip to the upper lip. It's very important that we understand that naturally our bottom lip should be slightly larger than the top lip. That's a natural ratio. So we're going to do our best with hyaluronic acid fillers today to restore all of that. All right, so we are ready to get started. And the first thing that I love to do is I love to just take a step back and look at the patient. There's always going to be one side of the face or the body that is slightly asymmetric compared to the other. It's totally normal. We like to say that body parts, facial symmetry, they're like cousins, right? They're not like sisters. They're gonna have some differences. And there's different factors that play into this. What side you sleep on, depending on what type of, particularly we like to say try to sleep on your back, but some patients, they sleep on their sides, and we'll start to notice that one side is slightly asymmetric than the other. We're going to start with the mid-face, or what we like to call the cheek, that a lot of people know of. And how I inject is I use a cannula. We also here at Allenby Cosmetic Dermatology use a vein finder. It's this really interesting light. If you've been to our practice before, you probably have seen us use it. And we like to do that to avoid any blood vessels so that you can leave here and we can avoid having any potential bruising. Although bruising and swelling post-injection is very common for some patients, so not to be alarmed. So we're going to use a cannula and we're going to get started, and I'll talk to you guys all about that. So one of the things that I like to do is I like to have the patient smile for me first. And one of the things why I have them smile is you can see that she has a lot of fullness in her cheek right here. And that's what's contributing to when patients come in. A lot of times they say that they feel like they have these folds around their mouth, and that's because all of her volume is sitting right here in the front of her face instead of it being pulled back. And that's what we're trying to achieve when we do filler in the cheek area, is we're trying to restore that and pull all of this, essentially tack this back so that it gives that nice contoured, youthful cheek. So like I said, we use a cannula. Cannula is different than a needle. Cannula is a great way to avoid blood vessels as we're injecting and then retrograding or pulling out. And I like to do a little bit of a fanning technique to kind of build that cheek. So by injecting in the mid-face, what we're doing is we're restoring that volume that she lost. We're also accomplishing giving her that youthful contour. We're getting rid of the fullness in the front of her face, bringing that back. But we're also restoring some of that volume loss, and that's what's so great about hyaluronic acid. So hyaluronic acid is naturally found in our skin cells. It's something that as we age, we lose. It gives us that volume, okay? And as we age, we lose it. And so what we're doing is it's this gel substance really, that as we inject it, gives volume to the area, draws water to the area, and what it's going to do is it's going to give us that nice lifted volume that we have lost. All right, so we are going to now move on to treating the lips. I am using Juvederm Ultra Plus, and I'm using a needle on the lips. The first thing that I'm trying to restore is symmetry in regards to the lower lip being slightly fuller than the top lip. That's a very natural looking lip. The other thing that I'm trying to achieve is a beautiful defined border. As we age, we may start to notice a few things that happen. In our 20s to 30s, we'll start to notice that the lips start to not have as much fullness. The second thing that we'll notice, these lines that start to happen around the mouth. Those are very commonly known as smoker lines. You don't have to have been a smoker or be a current smoker to have them, but as time goes on, we start to lose that collagen, we start to lose that volume, and she has a really nice shape to her lips. So when I look at the lips and I assess the lips, she has a really nice shape, like definition to her lips. So, but what I really do need to do is restore this bottom lip on her. She has such a much smaller bottom lip compared to the top. The lower lip was being turned inward because her chin was being turned, she doesn't have such a great projection in her chin. And one of the things that we try to do with filler is we try to restore that. And that's why we start to notice the jowling or these folds down here. So what we try to do with filler is we try to restore that. One of the things that was starting to happen was her top lip was starting to become overpowering. And sometimes in patients that happens, we like to talk to them about, like any dental history, if they have braces, things like that in younger patients. But nonetheless, in this case, what we were noticing is her chin was the reason why this lip was starting to lose its volume. Okay, we're gonna move on to the top now. And what I'm gonna do is she does have some lines around her mouth, so I'm going to restore not so much volume in the lip itself, but getting rid of those lines. I'm going to, can you just plot that please? I'm going to help get rid of some of those lines around the mouth like we spoke about earlier. Alrighty, so we finished with her lips, and now we're going to move on to doing our neurotoxin. In this case, we're going to be using Botox, which is something that a lot of people know about. This is much different than filler. We just finished using Voluma for her cheeks and jawline, and then using Juvederm Ultra Plus for her lips. Now we're going to be moving on to our, like I said, our neurotoxin, which is Botox. And this is a totally different treatment. This is going to help relax the muscles in her frontalis, which is in the forehead area, between the eyebrows, which is a very common area for patients to be treated, and also around the eyes. Smile big for me so you can see that we start to have these what we call crow's feet, or some lines when she smiles and then relax, and then she has some lines at rest. Some minor lines also at rest on the forehead. Raise your eyebrows for me, but you can see when she has expression that you see the lines in her forehead. And then at rest, she really doesn't have any of those 11s or those deep creases in between the eyebrows, but when you make a frown, you can see that there's some movement there. So 3 things that I hear all the time when patients come in and they're talking about getting maybe Botox for the first time, or if they've been a repeat patient getting their Botox, is that they hate the lines in between their eyes, those 11 lines. They say that they're so deep. And another area that patients talk about all the time is the forehead. This is very important to understand, is that we like to start doing these treatments, whether it's, in this case, Botox, earlier for prevention purposes. And as time goes on, we know that this is a temporary treatment. Everything that we do here at Allenby Cosmetic Dermatology, these are non-invasive treatments. And so we're going to get, with Botox in particular, around 3 months or so on average. It can be different per patient, but in terms of its longevity. I bring that up because it's also important to understand when patients come in and they're complaining about these deep 11 lines, sometimes it takes several treatments to get rid of those lines. And it's not going to be smooth from the first treatment if those lines are very deep and if you are starting later in regards to getting your treatment done. All right, so what we're gonna do is you're gonna raise your eyebrows for me, and I like when I inject, when I start doing some Botox, I like for patients to be expressive because I wanna see where their movement is. In this case, in her forehead, she's pretty high, and then I'm gonna have you give me a big frown. Perfect, and you can see that she has a lot of movement here. So we're gonna start. A lot of patients want sometimes a lift. The next area that we're going to treat is around her eyes, the crow's feet area. And what we're going to do is we're going to do some little superficial injections, because this muscle here actually is very thin. And every patient, it's really important to understand that every patient has different anatomy. So one of the things we want to make sure is that we're staying high in the forehead.
The golden ratio is the way to beauty, and there are several things that our brains like, and one of them is proportion, and that's what the golden ratio is about, and I'll explain all that. But really, we're looking for beauty, and we have a beautiful person who we're going to be working on, and we're actually fortunate because she's already gorgeous to start with. That's the best way to make someone look good, is start with somebody gorgeous. But today we're going to be working on proportion, and that is how we lead to symmetry. So we want proportion when we're looking at beauty, and we want clarity of the skin, we want the texture looking good. So there's kind of a combination of things that make people look beautiful or pretty. So today we're going to talk about the golden ratio, and the golden ratio is actually been around for centuries. This is really an architectural ratio or number, and it's about when you have 1 to 1.618, which is it's called phi, not pi, not like what we eat, not like the circumference of a circle pi. It's actually called phi, and this is in all of nature, and actually everything that we see that we really like, it turns out that golden ratio is part of it. When you think of really attractive paintings that our brain likes, like The Last Supper, that is actually very phi ratio positive, meaning there's a lot of phi ratio in it. So it's pretty cool in that our brain just looks at things, it likes shape, and it likes proportion, and then proportion actually leads to symmetry. So we're not so engaged with everything has to be so symmetrical, because when you look at 1 to 1.618, it's not a half. And so when you start thinking of symmetry, people start thinking of halves. And if you put two halves together, sometimes if they're identical, it's actually kind of weird. So when you have something that is 1 to 1.618, or the reverse, 1 to 0.618, that's what our brain likes the most. And for some reason, there's probably some evolutionary background to this, where people who have this proportion actually bear children well and are able to survive, and our species continues. So that's where this probably comes from. Now, we don't know 100%, but we do know that in architecture and in beauty, these are the number one. So when we look at supermodels, what are we looking at? They have great phi ratios. So you have beautiful phi ratios to start with. You're welcome. All right, so today I have already marked a little bit, because it kind of is weird for people to think of not symmetry, but proportion, because I think forever we've always heard symmetry, symmetry, symmetry. Symmetry follows proportion. So when you're looking at faces, and like I said, I've already marked some of this, there are certain aspects to filling and doing some of our cosmetic procedures to reach an optimal correction, or our job is to make everybody as gorgeous and beautiful and feel good or handsome as possible, and that's by using certain phi parameters. So let's see here. Okay, so what we're going to do, the way we start this is we start with something that we can't change, and what we can't change is the center between the eyes. So the middle of the face is really more like a twin zone. When we're looking at the whole face over here, we're looking at more siblings, sisters, brothers. You want to have more matching, not identical, but close. But the more in the center, you want to be as close as you can get. And sometimes you can't totally get all the way there, but the closer you get, the higher the degree of beauty our brains perceive. So we're going to look at her between the eyes. This is called intercanthal space here, and that is our 1. Okay, then we're going to look at our 1.618. And what I did is I started up and I worked my way down, and this is how I always kind of looking at people anyway. So when I look at her, this is her line. Now, this is actually pretty common, but what it shows me is that she actually has a fairly high forehead for her intercanthal space. So, and it's something very inexpensive for people to do, is they can put a little bit of bang, and all of a sudden it changes her whole look. So when I kind of cover her face up right here, just a little, and it kind of reached that point, it actually changes our perception of the height of her forehead, and that actually changes our impression of her face and what's going on there. So for people who have a little bit of a higher forehead, they can just put a little bang, and you know what, that's zero cost. They can just do a little chip chop. So we're going to look at this pretty girl, and when we're looking, I always kind of recheck my intercanthal space because it tends to move as I talk. So as we all know, I'm a big talker. All right, so we're going to look at her eyebrows. Again, we have a beautiful eyebrow, but it's slightly long. So this is actually where we would want to stop with her eyebrow. So she kind of, and this is really typical. I see this very commonly in our, although our people, we all want to kind of make our eye look longer, and it's actually, it's not what we want to do at the end of the day. And I think she has, sometimes it's pencil marks, sometimes it's hair. So she has a little extra hair there. So on her, we're going to just check this real quick. Okay, we're going to check here. This is how long her eyebrow should be to be optimally corrected. Now, this, again, intercanthal space, is where the high point of her eyebrow should be. So what that means is that the eyebrow, everything counts. It's the little things that count and that make a change when we're doing stuff. So when we correct little stuff, it makes a difference. And this is just grooming issues. This is bangs. You know, this is something you can just do with your clippers. This is something you can do with just a little plucking. So we checked her width, and this is where her high point of her eyebrow should be, which she naturally is, which is wonderful because sometimes you have to kind of fudge it. So you can see my green marker right into her eyebrow. Now there's a cheater spot, because not everybody has these at home, is you can also look at the outside color. This is called the iris, where the color is, and there's a straight line straight up from where her outer color is, and that's also where her high spot is naturally. So she actually naturally has a beautiful arch, and it's also going at the right angle. It's about a 20%, 10 to 20% angle going up off of the eye. Now the area where you want to start an eyebrow is always right off of the punctum, so it's a straight line here. So at home you can do this. You can make a line, you can look at your eye color, make a line here, and the other cheater on this, if you don't have these guys, is you make a straight line between the nose, the outer area of the eye, and here. And so this is where you should be stopping with your eyebrow. So she's kind of in between there. It's kind of a little, there might be a little proportion off on her there, but it's very close. So she might just take a couple hairs off the end of this, and when you kind of cover it, you can kind of see a little bit difference on, let's say, okay, these are all in 5 proportion. It may change your perception of what she looks like. So that's what we're looking at, is everything kind of has to have its little tweak. I don't know how this happened to match your eye color. Anyway, okay, so we're going on the other place. So we look at foreheads. We're looking at eyebrow shape. We're looking at the bend of the forehead. Okay, other things that are very important are angles, and she actually has a really nice angle. She has the pretty much like there's just a sliver, and let's see if we can capture this on the camera. She has just like a fingernail's breadth of angle here, which is perfect. This is exactly what we want. As we get older, one of the things that happens is, you know, we do, and I've talked about this, is that we do shape change and the skull changes. You know, the whole body absorbs bone and remodels it, but we start getting this more slant back to the forehead. And when you have a real sharp angle, it starts blunting the forehead, and we have to put filler to bring it more forward. So we're going to go down a little further here. She has spectacular eyes, and everything about her eyes are pretty much perfect. Basically what you're going to see is it's all going to match up here, and she matches directly from the intercanthal space again to the width of her eye here. We also divide up the face in fifths. So we divide the face up in fifths, and you have a center piece, which is your first fifth, and then you have 2 spaces on either side. And she actually matches up nice. I'm not going to write all over her face because she's too pretty to write on. So what we're going to look at now is pretty much mid-face. Again, this is always our starting point, and we always want to check what's going on in the middle of the face. Her nose actually is maybe slightly longer than it should be for her nose, for her width of her eyes. And you know, that's normal. This is just things that happen, and you're not going to blunt the nose. If she had too short a nose, sometimes we can add a little bit on the tip. But it's basically, this is how long. You start right at this midpoint of the nose here, and you're checking right here. Okay, so when we go further, we're checking on the cheek, and the cheek space was really out here, and it's between the outer part of the mouth, and I drew it to the ear and the eye. So when people come in and they're like, I don't want to look crazy, part of it is because people are putting the cheek in the wrong place, where it really should be out here in this outer quadrant of the face, in this triangle space. Now the high point of the cheek, there is a spot where we want to have a lot of light reflection, and it's really going to be, now she's actually just slightly off, so I'm going to just show you with this. It's really the outer note from the nose to the outer ear on the top of what's called the tragus over here, and it intersects with the eye. So it's actually about right here is where we want to see the high point or the light reflection. That's called the apex of the cheek. So it's nose, ear, eye, and that's the spot. So that's going to be where you get the most projection. So when you see just this gigantic sausage in the cheek, you know, that's not attractive, and that's where people are like, I don't want to look weird, I don't want to look crazy. It's because these principles are not being followed. When you follow these principles, it just enhances our prettiness, which again, you're already pretty to start with, so it helps. Okay, so we keep going down and we look at the width of the nose. I put this line here because that's really how wide her nose should be. She'd actually slightly bigger than her width, and you can't really modify that too much. Sometimes you can put a little filler and try to bring it in slightly. You can use a little Botox to relax it a little bit, but that really ends up not so wonderful. So at the end of the day, it's really hard to adjust this too much. You just want to camouflage things that you really can't change. So if there's something that is not changeable, what can we do to make it not visible? You know, again, that's why we use a little bit of hair down. So the width here, slightly bigger, but that's okay. Her lips are actually beautiful. I'm going to give you a little peek here. When you look at the lips, it just kind of is a continuation on into the chin. Her chin is pretty spot on as far as what the width should be. And these little combinations, and you know, nobody's perfect, and that's why we want to make sure, you know, she is definitely gorgeous, and you have to realize that putting these little things together doesn't always mean that you have to be perfect with this, because you still can pull it off by having other little things that are so perfect that people don't recognize, or we can camouflage some of those other things. Okay, so you know, she has a gorgeous smile, and that's huge. And a lot of times in the practice, you know, people come in and they're asking, can I have my lips done? And the problem is sometimes if we do the lips and it throws the face out of proportion, no, we don't want to do that. You know, we want to make people as gorgeous as we can. And if making the lips look abnormally large, sometimes that just throws everything off and people look older or they just look unattractive. You know, so that's not the purpose of this. So let's take a look at her mouth. Now it really should be, the width is going to be the inverse of the 1. Okay, and there's so many different ways we can use this. We can actually go even opposite. We can go in here, we can check this, and we're going to look at the width of where her Cupid's bow should be, which she's almost perfect. So you can use the 1 to 1.618, or you can use the 1 to 0.618. So we use these parameters every direction, and you'll do this. You can get a piece of string and do it yourself at home, and you're going to see what you have in proportion and what you don't. And the more we're out of proportion, the more we usually don't like the look. Just so. Anyway, so she is gorgeous. She does have a little bit of problem with this particular side of the lip on her. Now I'm going to just pull her lip up, relax your mouth, and I'm going to see your lips. Let me see your, actually let your lower your mouth hang a little. Let me see. Okay, now this is very common, what I see in the office. She has gorgeous lips. Everything looks beautiful, but we may never get totally proportional on this one side because it kind of dies down a little, and it's because she has a little more bend in of her teeth, and we can actually see that the teeth project more on her right than on her left, which is this side. So you're seeing a little bit, and her teeth are gorgeous, so we wouldn't want her to change anything, but they just, whenever we have, whether we have braces or we've had, you know, some people have veneers, whatever, sometimes they're just following the natural bite, and sometimes one side kind of bends in a little bit, and you tend to bend on this side. So she'll always have a little more of an issue with the line here. She'll have a little more flattening of the lip on this side. You can build it up some, but sometimes it's really hard to fix it. So we don't want to chase it too hard. Again, the further out we go, the less we want to make exactly the same. I think in here, we definitely want to hit her a little bit on this one side and get a little more shape. And then if it does happen to go a little bit nicer on that one side, great. If it's not, we're not going to chase it. So we are not really seeing any lines or wrinkles on her. We're really seeing things that maybe we can adjust proportionally, and they're going to look prettier at the end of the day. Again, I think she's gorgeous, so it's kind of hard to make something this pretty look prettier, but it is kind of interesting. We'll see how it does. We're going to do one side. I'm going to leave the markings on that side. We're going to work over here, and we're gonna check on this side and see what's missing. Now, the other thing to do too, when we look at jaw lines, again, we go back to that intracanthal space here. We should have a jawline that is right at the bend, which she's at, and this is perfect. She has a perfect line right here, right at the bend over the jaw. You know, right in front of this is where the jowl starts, and this is actually this perfect length for her. This is matching perfectly. So we want to make sure that the other side is correct too. And you can see that she's slightly different on this side versus that side. And she might have had a little filler in the past, and probably somebody was correcting her a little bit, because she looks like she's been, this side seems to be a little bit more of the side that we consider the side that's a little bit more work to do. This side is actually her side that's actually better. So I get to work on the good side first, and then we'll work on the other side after. But we'll show the end result. Okay, so make a frown for us. Okay, so obviously she's had Botox in the past because she has hardly any motion. And when somebody does have a real strong, make that face again. Okay, when it's really exaggerated, people think we're angry. And sometimes when you're just thinking or you're squinting, you know, and we all look in the computer screen all the time now, so everybody's squinting all the time. You know, when people are squinting, sometimes everybody thinks they're angry, because this is kind of the face that people give when they're angry. And we definitely want to kind of reduce it or eliminate it, but she's pretty good already. But I think we can just improve upon it ever so slightly. Now, one of the things, let me see, make a frown again. Okay, raise it up. It is interesting, you can really see when somebody has toxin, a Botox procedure beforehand, where other muscles start pulling. So this is the reason people really should treat fully when they're having their Botox. Again, give us another frowner. I'm forcing you to work. Yes. So you can actually see some of the muscle action coming from higher up, which is called the frontalis muscle. So if we treat these little muscles, which is called the procerus and the corrugators, you're going to see that some of the frontalis is contributing to the push down. And we want to eliminate some of that, so we have to use a little in her frontalis. Give us a nice squinchy. Okay, when she's squinching, this is actually even more important for her, and it's less commonly treated. I definitely want to get the little scrunchies right here, the nose scrunchies. If you're smooth everywhere and then you have scrunchies, it kind of is a disconnect in the brain. So we have to make sure that we use a little Botox in her scrunchies here. And that is considered an off-label use for Botox, but you know what? It works. So we're going to use, and she's a little, one of the things she talked about earlier was she doesn't like under her eyes. She feels like they're liney or is that what it is?
I feel like that's where I show my age. Yeah.
Okay. She doesn't show her age anywhere. Okay. But she has a little bit of normal crow feet. Now this is normal action. We have a circular muscle here. This is called the orbis chloris oculi. And whenever you see whatever muscle you have, the lines will always be perpendicular to the muscle. So the muscle is circular, so there's a circle here, so the lines will come off radially. So I consider these, I call them medial, meaning middle of the face is called medial, and we have medial crow feet right here at these scrunchies. So all of these are coming from the eye area. So we can go ahead and hit her with Botox, and we're going to Botox the whole muscle all the way to the inside, and it's not really coming from her nose, it's actually coming from her eye. So we're going to get a little closer in here. If you really have what we call bunny lines, pull your nose up. Little bit more, you can see a different muscle action here, so it's a little bit more higher up, and sometimes you see more of those little horizontal lines there. Those are bunny lines, and those are actually more the nose is bringing those out. So it kind of tells me where to treat it. So it's not just, you know, a pattern that every single person's going to have the same thing. We have to look at what she needs, and that's the important piece of doing this, is understanding each face individually and having a plan for each person. Alrighty, now she has gorgeous smile. We wouldn't want to change any of that at all. Even her chin is beautiful. Sometimes we use a little toxin down there too. But, you know, I kind of think that Botox is one of the tools that is just fantastic for the upper face. It is the one that lifts the face. It opens the eyes. People feel younger as soon as they look in the mirror. It's like a day later after their treatment. Wow, their eyes are open and they just feel fresh. Yes. She's like, yes, I know that feeling. It is a wow feeling, I have to tell you. As all these, when you just make these little teeny changes, that's the real way to make somebody look good. Because we want to keep her looking like her because she's beautiful. We just want to just augment and make sure that everything is amplified in the pretty area, not in the places that we may have to minimize. Let me take a look here. Okay, so what would we do on her? And it's really about what is the face saying to do. Now on her, let's just check on her other side, and I'm not going to write on her on these. Want to check her eyebrow. Again, same issue, a little bit lower. Back to the eyebrow for a second. The eyebrow and this side actually is not as strong on as the side. The eyebrow, the inside piece, I call that the medial eyebrow, should be a little bit lower than the tail. When the eyebrow, and I actually do a lot of discussion about eyebrow. Everything is important on the face. So if she were doing her eyebrows, and I am going to mark you on this one, the eyebrows should be a little bit lower starting point than the tail. And again, we want to go middle and length. So the length of this should be about here. Okay. So if she took off this little piece right here, it would be the proper length for her eye. And if you want to exaggerate ever so slightly, you can, but not too much more than that. But the tail should actually be higher. So it really should be, the green might overpower her normal color. So you can kind of see, let's just check real quick where her high point is. It's perfect on her, okay? So you can just do this at home. And I know green is kind of not the right color for an eyebrow here, but it kind of pushes the point a little bit more of what you want to achieve. And it's a lower front piece of the eyebrow, a high point at the color of the iris, and you need to make sure that you're stopping at the right point. Now I have a little wipey here to make it look a little, let's see what she looks like with a green eyebrow. I might need a little Q-tip. My assistant will grab one for me here. So it's actually kind of an eyebrow lesson, and it makes a huge difference. We actually do have a fantastic microblading provider here. Her name is Nani, and she's fantastic, and she does a great job in actually doing the microblading type of tattooing, and it really makes a difference when you have an eyebrow. And the younger population do understand eyebrows. The older population, we grew up, and I'm going to put myself in their category, we grew up with the fine pencil eyebrow, and that is definitely not one popular normally. Like right now, the fashion is not like a thin eyebrow, it's a more robust eyebrow. Thank you, Kardashians. And a lot of celebrities kind of set the pace of what's going on out there. But when you see it a little lower, a little higher, and a little bit more stopping earlier, that actually is the correct proportion for her, and that makes the eye pop more. Everything is about how do we make every little piece a little better. So then we go down to her cheek, and she actually has great light reflection where she should. And I'm kind of visualizing where it should be. Again, just, I don't want to mark all over her face, but it's from the nose to the ear, and then the outer eye. That's exactly where it should be, and she has light reflection, so she's actually really good there. So we can just make it a little bit more fuller, just a little bit, but it's going to be in that triangle space, like I have that big green triangle over there, just a little bit more in this space to kind of give it that nice soft cheek that she is going to help her face look a little bit more, just a little tweaky out and prettier. Okay, so now we're going to be fixing with voluma, because we want voluma and we want a little bit of a cheek shape in here. So we're going to use something that's going to give a little more bounce to the face, something that's going to support it and last a little bit longer. We're going to use it out here. Let's keep going to the side a little bit. She has, again, a beautiful angle here, and honestly, this is a better angle than most people coming in the office. We want to make sure there's that nice shirt, like that nice 45-degree angle here, because as we age and the bone absorbs, this angle becomes a straight line. So when you see somebody who's had a facelift, sometimes they have no wrinkles, but they just kind of look old still. And a lot of it's because the shape is the older shape, and we're trying to recreate a more youthful shape by adding a little bit of filler here if it's necessary. We might put just a drop just to give her a little bit more youthfulness, because it's probably going away slightly. She's not hormonally too deficient yet that things are falling apart, but she will eventually, but we'll give it a little more nicer, just a drop more in this area. Now on her lips, and I'm going to go from the side view here, this is really important, and this is kind of an issue because so many people are overfilled in the mouth. Now she has beautiful proportion. The lips should be either 1-to-1 or slightly bigger on the bottom than the top, and she's pretty much 1-to-1. And again, I think she's had filler before, so it's probably somebody's been working on her. And the other thing is we want to make sure that the projection of the mouth to chin is correct. This is called Rydell's line, and it is really, she's almost perfect. Usually we have people, especially if they've had chin implants, they lose a lot of the bone there, so everything kind of sinks in. So if you've had a chin implant, don't be surprised if you come in and we have to fill, because it usually ends up kind of sinking in a little bit. But we want almost a straight line to a little bit of an angle back, and I don't want to necessarily touch everything here, but it's really pretty close to a straight line. It's exactly where it should be. Okay, so a little bit of cheek shape, and that's going to be the Voluma on her. I think that's going to be perfect. We're going to use a little bit of velour in her lips, and that's a product that's soft and it's very elegant for the lips. It is it's like a Juvederm would be the other choice, but Juvederm might be a little too firm for you, and she really just kind of needs to have a little bit of the texture changes in the lips, because she's getting a little bit of those little fine lines in the lips, and we want a real smooth lip, so we want it to be a little more glossy looking. So you can use velour or even Volbella in the lips just to give kind of that gloss look. And let's see what else we're going to do here. Now we're going to go a little bit off the reservation, because that's my go-to. I kind of keep getting drawn back to her forehead, and I think what's happening with her and everybody else, let's see here. Yeah, okay. So, and it's really obvious to me that she's sisters and not twins on her face here. So we can put something that's happening to her, and it's because we're all aging, is she's losing a little bit of shape of her cranium. This is the top of the head here. And I'm going to put a little bit of filler out here to kind of bring her face a little more forward. She has that good angle here, and it's actually better on this side than this side. So I'm going to put a little bit to kind of match her up a little bit, and that's going to kind of pull her face forward a little bit in this area. One of the things that happens with the eyes, and it's just slightly, maybe this is what she's seeing, is that the eyes go from a forward look, it's almost like telescope looking, to almost fish-like. And it's the bone remodeling that does that. So on her, you're almost seeing a bend back. At this point, you're seeing the eyebrow kind of wrapping behind the bone there, and we actually want it to kind of project out slightly. So I can use a little bit of filler in her eyebrow and kind of force it forward a little. It'll open up her eyes, and her eyes are her, like, she's beautiful, but her eyes are her beauty. Like, that's where people want to look to, because it's her expression, and they're beautiful, and she has a beautiful color, so people will naturally go there. So we want to keep them there. We want to always kind of distract from usually lower face, because there's always things with the lower face. So we're going to bring her eyebrow out slightly, and I'm going to use a little bit of Juvederm in that area, and it's just going to give a little bit of a push out. I think her nose is perfect. I wouldn't touch it, but sometimes somebody might have a little bit of a hook, and we can put a little filler to kind of fix that. When I get to her cheeks, like I said, a little Voluma. And again, I think she is just so pretty. I think she has a lot of projection in her chin. So I'm going to see what I can do to kind of maybe give a little bit more projection in the mouth area. And you kind of see that from the side. There's a little bit of more projection on this side than here. So I think you are just tweaking you out. You're gorgeous again, and it's really so how can we make you even better? And this is actually pretty easy.
Do your magic, Dr. Allenby.
Thank you. All right. All right, so Carla and I are talking, and she I think you can say exactly what you just said.
Yeah, I just feel like I'm starting to get a little bit of jowling going on here. The skin, I'm wanting to kind of just like pull it a little bit.
Okay, and your eyes are...
In my eyes, I think it's really the texture of the skin. Not so much that I feel like there's not volume there, but it's just the texture of the skin. The lines bother me.
Okay, so this is important, and this is not proportion stuff, but this is important information because she needs to see a change. When a patient comes in, they want to see a change. And when we do some changing in her cheek, it's going to lift up her very small jowl that's beginning to happen. And the jowl happens because we lose all the shape everywhere and everything ends up here. So we see aging usually here the worst. So you're going to see aging in two places. One is the eyes most often, and one is in the mouth area. And it's because we use these areas all the time. We're always looking, we're always talking, we're always chewing. So you end up seeing changes with the eyes, and that's why we're going to do correction on the eye today, because one, we see the crepiness and it's ever so slight with her. So we may not want to fill it, but we may want to use a different tool, like we might want to use one of my other devices like a Fraxel machine or the microneedling radio frequency machines. I think once we get some cheek in, the eye is not going to look as bad as she thinks it looks, number one, but it's also going to lift up some of this little baby jowl that's happening. So we're kind of starting in the middle of the face to make things look better, and it's going to be here. And what happens, it's interesting because you have to see it as a patient. You have to see the changes to go, wow, this is worth my time. In my world, I want to really fill here because this is actually what's going to set up for long-term not getting a facelift. So I have to let people see this first and kind of understand what shape does for them. And then later, and when I do this, I'm going to let you see what it looks like. But then when I put it up here and it starts lifting up everything, wow. And then over time, we kind of work our way back and we keep lifting up. You know, my goal is to use tools like the microneedling radio frequency, like the Fraxel, the tighten, and not just fill, because then you're just going to look like a bowling ball or a pumpkin, you know, and that's not the goal here.
No.
So our whole goal is to actually keep the shape of youth, and that way you're not having to feel like you need to go get a facelift. So if we can support the face and the tissue as much as we can, that's the goal with this. Okay. All right. Okay. So we talked about the golden ratio, which is so important in my mind while I'm working on her, and that way we're not trying to go for symmetry, we're trying to go for proportion. So the other part of this is really just looking at the patient, which is very important. You know, I want patients to feel comfortable coming in and saying, do what you need to do instead of fill this on me, because it's really, I need to diagnose and I need to do the correct thing for the patient, and sometimes they don't really understand what's going on with their faces. When you come in, I would show you all your pictures, front angles, side angles, all the different directions, because I want you to understand your face 3D and 360, even your whole head, because it's all important, you know. So just doing lips sometimes is not the answer. Just doing nasolabial lines, that's just like 2000. It's not 2020 or 2021 or 2022. So, you know, it's really about looking at the face, getting those proportions set in my mind that I want to improve her attractiveness is the key with this. So when we look at her, it is really, I mean, beautiful. You know, I think she is getting a little more weight down on the lower face. She tends to be fuller down here, and it's normal to start sliding down as we age. We start having a little bit more laxity down here. Part of it is lack of laxity, lack of elasticity of the tissue, some fat absorption, some muscle starts going away. So you start sagging, and it all ends up right in here. This is where people, usually in their 50s, they're coming in, they're like, I hate this, I hate this. When you're younger, it's usually, I don't like my eyes, I don't like my mouth. So what we're gonna do is, she's in the age group where this is just beginning, and if we can correct it, it's going to hold her from feeling like she needs to get a facelift. So we're going to do some things to correct this bottom heavy look by mechanically just lifting her up. So we're going to use Voluma, and my choice for Voluma is because I want something that's going to be pretty sturdy for her. So Laura's going to make a little light for me here, and I can see her vessels, so we don't hit a vessel, thank you. And I'm going to make just a little baby opening, and I'm using a cannula. And that's just a little needle to open the skin. So what I'm doing is I'm actually traversing into that triangle area that I want to get more full and lift it up. Now you're actually watching her cheek just lift as I'm doing this, and I'm just repositioning my instrument called the cannula. This is not a needle, so it doesn't disrupt the tissue. And this is something that you can leave, after you're done, you can leave and go to a party if you want. Usually I want you to not have any alcohol, aspirin, blood thinning type of products prior to coming in for a couple of days. That really helps not bleed as easy, and then it also makes you bruise less. So I am just adding a little cheek shape, and already, wow, this is really changing. So she's getting shape here, and this is lifting. So we're giving her a little bit more augmentation in the cheek, and I'm using the same opening. Let me have a new setup, please. Thank you. And wow, gorgeous. Okay, she's very pretty to start with. This is just like icing on the top, cherry on top. And I am just trying to create a cheek shape and a lifting. I'm actually wanting to use this as kind of a lifting area, and it looks absolutely gorgeous on her. One of the things, now that we have this doesn't look big. Again, we're camouflaging this, and so lifting it, one treats it, but it also camouflages what's going on down here. Now that we have a little cheek, I'm seeing a little bit lack of here. So I'm gonna put a little more voluma out here, and again, I want something kind of stiff, and that's what voluma does for me. I need my opener first, please. Okay, thank you. I'm gonna trade you back this. Okay, and I am just making a little baby opening down here. She's a little fair complexion really sometimes shows these little kind of like a little swell to the tissue sometimes with the openings. They're gone in like 5 minutes, 10 minutes. So it's kind of like when you do your Botox, you get a little red blubs and they're gone in a few minutes. So it's no biggie. And I gotta find my opening. There, I found it. That's the hardest part of this, is finding my little teeny spot there. So I'm going to put a little jawline, and she's starting to get a little empty back here, but it's not much. And I'm not using a ton here. I'm just kind of giving a little more shape to her mandible here. So a second ago, there was a little bit of a disconnect, and sometimes you see just cheeks walking around. You have to have a little down here too, and you have to have things connect. One of the things that I'm thinking while I'm doing this is making sure this is connected to this and this is connected to that. So you have to make sure things are connected. When they're disconnected, it starts looking older. As we age, we really do disconnect, like the cosmetic units become more individual looking. Like the mouth looks like it's its own entity. So a little here changes this, and it gives it a straighter line. So on this side, we can see there's a little bit of a very, very light fat drop here. So when we put it back here, it's going to give it a straighter line. Just like here, now it looks straight. So to complete it, and I won't use voluma here, I'm going to use Juvederm. I'm just going to finish it out right here. So I'm going to give my assistant back this. So I'm going to just make a straight line right here. And Juvederm is a little better for more the front of the face, like in a more motiony area. It has more flexibility. The voluma is beautiful, but it's a little stiffer, and we don't want her stiff when she's speaking. I don't want to add too much to her chin because she has a very strong chin, and if I add too much, she's going to end up looking bottom heavy. Again, her eye area is the area that we want to really see pop. Now, even just putting a little in her cheek made this look cleaner. I am going to put a little bit in her eyebrow, and that's going to open up her eye more, and thank you. And I need my opener. This is a kind of uncomfortable, but it's using a cannula. It's very safe. If you are you got Rambo injecting you, you can get into a little more trouble with this area. These are more delicate areas, but everything is about gentle finessing the tissue.
That's incredible.
It's funny, like it's very impactful for our patients when they see the eyebrow fix. It does make a huge impression, and I almost always hear people surprised on how much improvement it makes the eyes look. So now this is a little less. I still think she's good to having a little Fraxel here. It's one of our devices to tighten up the skin. Using products, that's another way we use to do the growth factors, things that are going to grow the tissue. I want to get a little bit up in the hairline like I talked about earlier. You can just hang on to that down there. We do turn a little Mr. Peanut heady as we age, and it kind of goes whoop. And we're going to look for a little spot to make an opening, and I like to do it more right at the hairline on this. I might use another product if I were going further back in the scalp, but right along the hairline. And honestly, I could use Juvederm or Volume on this one. That little change really did. You go ahead and take a peek in your mirror here.
Yes. Oh my gosh.
It is interesting. So just having a little shape change, and you can see just a little bit makes a big difference.
I'm just looking at one side compared to the other, and that's incredible.
Good, good, good.
Love it.
It's fun, you know, and that's what this is. This is why I'm still working, because this is fun. And she's pretty, and it looks prettier. And you know, when you start and you're like, wow, she's so pretty, where do you start? It really is, we go back to proportions and what's starting to show because of age, and how do we make it prettier at the end of the day. Okay, so we didn't do her lips, we didn't do the nasolabial lines, but gosh, when you look at all this stuff, everything looks better, and it's because these little teeny things make a bigger difference. Now, it isn't like we're using a little bit of this, we're actually using a couple syringes of it, so even though they look like small changes, they're actually pretty big changes here. Wow. I love it, I love it, I love it, I love it. So in the mouth we do one or two things. We're going to either use the cannula to fix, or we're going to use the needle. In this case, just because it's flatter on that one side, I'm just going to use a little bit of the cannula. If I really need to pull your lips out, which you don't have that issue, you have a nice lift to your lip already. The space between here to here is good already. Sometimes when we get older, it gets long, and we do have to kind of flip it up here. So that's called the lip flip, whether we do it with filler, Botox, surgery, those are lip flip ways. And this is a little uncomfortable, and I'm sorry. I'm just going along this border, and I'm going to get a little right in here. I do like her having a strong lip area because she has a strong chin. Also, having a little in her bottom lip is going to help kind of de-emphasize the projection that she has in her chin, because she has a strong cheeks and chin area. Having some of those little baby wrinkles pulled out, it stays in there and it holds moisture, so the lips will look softer and more supple. In particular with the velour and the Volbella, that's what they're kind of known for. Wow, so you're gonna look and go, oh wow, they're big, they're gonna come down. Okay. So whenever we do lips, they're never as big as what we see right when we put it in. Let me have a little bit more. So right now, like I did like her lips to start with, but they were kind of off. There were some symmetry issues. So we are going to see, this is going to come down, so within 2 days it starts going down nicely, and it'll still be stronger than her chin, because her chin again is strong. Okay, so I'm never 100% satisfied. I always have to kind of tweak things out. I just see a little bit still missing from this one side of her face with the cheek, and just going to get a drop more, because this is her side that she sleeps on, so it's a little emptier than the other side. So we're at a syringe and probably a quarter on this one side of Voluma. Again, the Voluma is, there's really at this moment, there's nothing like it. It is just one of those products that is very consistent in the way it lifts and shapes, and people just do fantastic with it. That's much better. Okay, so we're gonna go ahead and do our Botox, and so again, she doesn't have a lot going on here, but it's ever so slight. A little trick for under the eye. On her age group, she can get away with it. I'm just going to put a drop of Botox here, and it's going to help some of those little crepey things that she doesn't like.